Hello, welcome to the Primary Care Fund Fiscal Year 26-27 application review. This is the recorded version of the application review meeting that we hosted on March 12, 2026. My name is Tracy Gonzalez with the Department of Healthcare Policy and Financing, which you'll also hear referred to as HCPF throughout this presentation. And I'm your point of contact for the Primary Care Fund program. Today's agenda includes an overview of the application, data validation updates, program funding, a few changes and updates to the program, and some information on the Provider Stabilization Fund. We'll begin with the application overview. Application submission is done through SharePoint, which is an external sharing site. Each agency has their own SharePoint profile page and must have registered users to access them. The application was released on February 23rd, and it can be found in the folder labeled 2026-27. Now, SharePoint also houses all of your historical applications and supporting documentation. This is extremely helpful if this is the first time that you're filling out the application and you come across a question within the application that you're unsure of how to answer. You are able to look back at the previous year's application and the supporting documentation to get an idea of how those questions are answered. If you are a returning applicant that has had staff turnover and need to request a new user for your SharePoint profile page, please email the Primary Care Fund email address, include your organization's name, the name of the individual you're requesting access for, as well as their email address. They will then receive an invitation to SharePoint, and they can follow the instructions to complete their setup. If you are an entirely new applicant that has not received any funding from the Primary Care Fund in the previous years, a SharePoint page will be created within 2 to 3 weeks for your agency after you submit your intent to apply. And as always, you can reach out to me if you're having any issues with your SharePoint site. The application is in an Excel workbook. Some applicants have run into issues of not being able to see the entire content of certain cells when opening the workbook in SharePoint. What I recommend doing is opening the application in the desktop app. You can do this by clicking on the viewing option on your toolbar and then selecting Open in Desktop App, as shown here in the screenshot. Opening in the desktop app is also nice because it will continually save your work to SharePoint. So if you're like me and you're working in different screens and different programs, you do not have to click save every 5 minutes or worry about losing your progress if you accidentally close the document, because as I said, it is automatically saving to SharePoint. You also have the option of downloading the application to your desktop and just working on it at your leisure. If you do download the application to your desktop, you'll want to make sure that you upload it back to SharePoint once you're ready to submit your application. There are multiple tabs within the application workbook. We won't be going over each and every one of the tabs today, but we will be touching base on the majority of them. Let's start with the instructions and the checklist tab. The instruction tab has the application response instructions. As a reminder, please do not convert the workbook to a PDF. Please leave it in its Excel format. Remember to keep all documentation for 5 fiscal years. And as stated in the instruction tab, all materials submitted during the application submission become the property of the state of Colorado. The link to the Code of Colorado Rules and Regulations is also included in the instruction tab. I recommend visiting this link to refresh yourself on the rules of the Primary Care Fund program. And also, if you have new staff working with the program for the first time, This is a great link to direct them to so they can familiarize themselves with the program. The checklist tab is simply just that. It's a checklist where you can go ahead and mark down as you have completed the tasks. So as you're filling out the application, once you complete a task, you can mark it off as done and move on. In the agency information tab, you'll be filling in your legal name, your federal employer identification number, mailing address, and your primary and secondary contact information. In the upper right-hand corner of that tab is a set of 3 checkboxes. The first is as to whether or not your clinic is a federally qualified health center. The second is whether you're a corporation, partnership, or other. And the third set of checkboxes is your certification and licenses. Please upload a copy of your certification or licenses to SharePoint. And also make sure that the duration of accreditation is stated on them. The bottom of the agency information tab has your average cost per visit. There is no set formula for this. The example that we use in the application is the UDS medical cost per medical visit formula. But again, there's no set formula. This is your clinic's average cost per visit, and it does need to be filled out. Question 1 has a few different components to it. And the first component we're going to look at is the freeze state. The freeze state acts as a point in time in which your data is fixed and definite so that your unduplicated patient count can be made. Your selected freeze date must be between December 31st, 2025 and the application submission date of May 22nd, 2026. The patient's visit closest to the freeze date is the source designation used within your application. Let's dive into the patient count. The unduplicated patient count is the sum of patients who have had at least one visit and received at least one of the services under the definition of comprehensive primary care during the applicable calendar year. It should not include counting a patient more than once if the same patient returns for additional services and/or products during the calendar year, or if their payment source designation changed during the calendar year. Your count should exclude individuals who have only received services through outreach events such as community education programs, nurses' hotlines, or any other type of community-based events that are not documented on an individual basis. The count should not include individuals who have only had services from large-scale events such as mass immunization programs or screening programs, and individuals whose only contact with the applicant agency was to receive special supplemental nutrition program for women, infants, and children. A patient can only be included in one of the payment source designations listed in the question 1 table in the application. And we'll be going over that here in a few slides. The patient's payment source designation in the application response should be the payment source listed for the patient at the last visit closest to the freeze date. We'll take a look at a few examples of what this looks like. For this example, the clinic's freeze date is December 31st, 2025. So we're looking at patients that were seen from January 1st, 2025 to December 31st, 2025, which is their freeze date. And again, we are looking at the patient's last visit closest to that December 31st date. Patient A was seen on January 20th, 2025, at which point in time they had Medicaid. They were seen again March 11th, 2025, at which point in time they were uninsured. And then they came back again December 11th, 2025, and their payment source designation had switched back to Medicaid. Since December 11th visit was the last visit closest to the freeze date of December 31st, Medicaid is going to be the payment source designation used in the application response. For example 2, we are going to take a look at a clinic whose freeze date is after December 31st, but before the May 22nd application submission date. So in this example, the freeze date is April 1st, 2026. So therefore, we're looking at the patient seen from January 1st, 2025 up until April 1st, 2026. Patient A was seen twice during that time frame, once on January 20th and again on March 11th, 2026. March 11th, 2026 was the visit closest to the freeze date of April 1st, 2026. So uninsured would be the payment source designation used in the application response. We're going to dive into that question 1 table. This is your agency's unduplicated patient count and the methodology used to calculate your low-income uninsured patients. You're going to start off with your freeze date, and please do make sure that that freeze date is included. When I'm reviewing applications, that's one of the areas that clinics seem to omit. So please do make sure that your freeze date is listed. And then in step 1, you are going to identify the total number of unduplicated patients served by your agency between January 1st, 2025, up until your freeze date. Moving on to step 2, we're going to begin deducting patients that have A, Medicaid, and that's either primary or secondary, B, CHP plus, C, any other type of reimbursement for healthcare costs by a government program. So that's going to be your Medicaid, Social Security, Veterans Administration, and etc. And then D, any other third-party payer not mentioned above, such as private insurance. Once you have bucketed all of the patients that belonged in the categories in step 2, step 3 will auto-calculate and give you the number of your uninsured patients. Moving on to step 4, you're going to deduct how many of those uninsured patients were over income. So that's going to be your patients whose federal poverty levels were at or above 200% and their last visit fell between January 1st, 2025 and June 30th, 2025, as well as patients whose federal poverty levels were at or above 201% and their last visits were on or after July 1st, 2025 to your freeze date. The number in step 4 should also include any patients whose federal poverty levels were unknown or undetermined. And then step 5 is going to auto-calculate for you again. This is your low-income uninsured patient count and the number that your award is based on. An eligible patient is a patient receiving medical services from a qualified provider whose yearly family income is from January 1st to 2025, January 1st, 2025 to June 30th, 2025, below 200%. So that's 199% or less of the federal poverty guidelines. And then effective July 1st, 2025, you could begin to count patients that were exactly at or below 200% of the federal poverty guidelines. An eligible patient is also a patient who is not eligible for Medicaid, CHP plus, Medicare, any other governmental reimbursement for healthcare costs, or third-party payer. So that's the reason that we deducted those patients from step 2 in the question 1 table. Now, if a provider is charging patients on a self-pay rate that is outside of their sliding fee scale or is not at a $0 rate, those patients may not be included in your step 5 count. They should be eliminated during the methodology process in the question 1 table. And when we are referring to eligible patients, we are referring to that step 5 count. So I just wanted to point that out. An eligible patient is your step 5 patients. Now, there are a few programs that can be a little confusing when calculating those step 5 patients. One of them being the Women's Wellness Connection, or WWC, which reimburses a limited set of services on a per patient service specific basis. Therefore, WWC patients should be categorized under step 2 in your application. And that is step 2C, which is any other type of reimbursement for healthcare costs by a government program. However, if a patient receiving WWC services also received other comprehensive primary care services at that same appointment, they can be included in your clinic's step 5 patient count if the patient was charged a sliding fee scale copay for the other comprehensive primary care services that they received, and if the services are distinctly documented in your billing system. The Ryan White HIV/AIDS program is another program that can get a little bit confusing. The program does have 4 parts to it. Part A, B, and C patients can be included in step 5 if documentation is submitted with your application supporting which part of the program was awarded and what type of fundings was received. Part D of the program is associated with specific patients and services. Therefore, those patients that were seen under Part D of the Ryan White HIV/AIDS program should be categorized under Step 2C. Patients seen for immunization or vaccines can be included in your Step 5 if they are an established patient that you have record for, if the immunization or vaccine was given in office or in the pharmacy and not at a mass event or something that the federal government is funding, and of course, if they are not covered by a third-party payer. And wrapping up the question 1 tab is your clinic's source of data. I know some of our participating clinics have numerous locations where they see patients. So this is where you are going to list all of those locations. And this is important because if you're selected for an audit, the audit team will be tying the data that you submit to the audit team back to the data you submitted with your application. So if the data that the audit team receives says that you saw John Doe at Sunnyside Clinic, and then they take a look at your application data and they do not see Sunnyside Clinic listed on this source of data sheet, then that of course would be a finding. So please make sure that this is filled out. If you do run out of room, you can create an Excel and upload that to SharePoint. Just let me know that that's what you've done so I can be on the lookout for it when I'm reviewing your application. Moving on to the sliding fee scales. To meet the qualification of a primary care fund provider, the provider must accept all patients regardless of their ability to pay and use the sliding fee scale for payments, or not charge the low-income uninsured patients for services at all. The sliding fee scale is a tiered copayment system that determines the patient's level of financial participation. and guarantees that it's below usual and customary charges. The factors to consider when establishing the sliding fee scales should only be the financial status and the number of members in the patient's family unit. In the sliding fee scale tab, you'll summarize your policies and procedures regarding your sliding fee scale. We do expect a minimum of 2 sliding fee scales. However, you could definitely have more than 2 depending on your free state, and also due to the fact that you could begin counting patients whose FPLs were at 200% mid-year through. The important thing here is just to remember that your sliding fee scale must cover the duration of your application. So, as an example, if you have chosen May 1st, 2026 as your free state, then your sliding fee scale should cover from January 1st, 2025, all the way through May 1st, 2026. Please make sure that your sliding fee scales include the time frame that they are effective. We also need corresponding copayments for each sliding fee scale. And even if your scale and copayments have not changed, we still need documentation to support your data. The outside entity tab includes the criteria and requirements of your outside entity. We do require your outside entity to sample a minimum of 25 patients. And please ensure that your outside entity is sampling the patients counted to your freeze date. So they're just not stopping at December 31st if your freeze date is beyond that date. Clinics required to increase their sample size due to data validation findings during the fiscal year 25-26 application audit were notified by email on March 6th. We do offer a waiver that allows providers to waive questions 3 through 6 of the application if they have been awarded funding within the previous 3 years, if they meet the eligibility criteria of a qualified provider, and they sign the waiver certifying that there has been no changes in their capacity to meet all eligibility requirements. The waiver does not apply if you are a new applicant, so all new applicants must complete the application in its entirety. It also does not apply if you have been notified that you have been selected to complete the entire application for fiscal year 26-27. And those notifications went out on March 6th via email, and agencies can expect to complete the application in its entirety every 3 years. I do have PDF versions of the waiver, the outside entity certification, and the confirmation by applicant to agency that are formatted to receive electronic signatures. So if you're having issues pulling those documents out of the workbook to secure those signatures, just send a request to the Primary Care Fund inbox and I'll make sure that I get those out to you. The question 4 consists of a total of 7 tabs, and those tabs include the components of comprehensive primary care. They are primary care, maternity care, preventive, developmental, and diagnostic services for infants and children, adult preventative services, diagnostic laboratory and radiology services, emergency care for minor trauma, and pharmaceutical services. Completion of question 4 should demonstrate that the applicant agency, and this goes for new agencies wishing to apply for funding as well, has a track record covering a consecutive 52-week period prior to the submission of the application of providing cost-effective care, and that the applicant agency will continue to provide or arrange for comprehensive primary care services to persons of all ages on a year-round basis. Agencies not providing any of those components of comprehensive primary care services to persons of all ages on a year-round basis must provide documentation of an established referral relationship. So, for example, if your clinic is an age-specific clinic and you're only seeing patients to the age of 18, you must have an established referral relationship in place where you can refer patients above the age of 18 to receive services on your behalf. Or if your clinic does not provide maternity care, you must be able to refer those patients to another provider on your behalf to receive maternity care. The established referral relationship is a formal written agreement in the form of a letter, a memorandum of agreement, or a contract between two entities that includes the comprehensive primary care and/or products to be provided by one entity on behalf of the other entity, any policies, processes, or procedures that are in place, and the guarantee that the referred low-income uninsured patient shall receive services on a sliding fee scale or at no charge. And it must include signatures by representatives of both entities. The only exception here in question 4 is the emergency care for minor trauma. We do not require an established referral relationship to be in place for emergency care for minor trauma. We're going to finish up the application part of the agenda. We didn't go through every tab of the application, so I do highly recommend using the checklist I showed you in the previous slide to make sure that all the tasks have been completed and all the required documentation has been uploaded to SharePoint. Once your application is completed and those documents have been uploaded, please email the Primary Care Fund email address stating that your clinic has officially submitted the 26-27 application. And as a reminder, the application response deadline is May 22nd. Now we'll move on to data validation and common audit findings. HCPF is required to conduct annual audits on the primary care fund applications. The audits consist of a comprehensive review of the primary care fund application and the supporting documentation. We remind you to keep all documentation used to complete the application for 5 fiscal years. And clinics selected to have their fiscal year 26-27 application audited will be notified in the upcoming months. Agencies can expect to have their applications audited approximately every 3 years. Some of the common findings that come up during the audit process are not counting secondary insurances, not verifying patients' federal poverty levels, incorrect copays, improper self-pay inclusion, and insufficient documentation. A few of the audit team's tips are to keep your unduplicated patient count records, and I can't stress this enough. Keep the data you use to complete question 1 of the application. Create a folder on your desktop and throw it in there, or put it somewhere that it is easily accessible. That way, if selected for an audit, you can easily pull that data from the folder and hand it over to the audit team. That way you don't have to recreate the wheel, and it does help eliminate a lot of those common errors. They also want to remind you that the sample request should include all visits, all patient charges, as well as their copays. Moving on to program funding. This chart shows the primary care fund awards by fiscal year, including the tobacco tax revenue, state and federal funds. As you can see, the tobacco tax revenue, and that's the light blue line in the bottom of those bars, the light blue shade, has continued to decrease year after year. The darker blue represents the federal matching funds, which providers began receiving in fiscal year 21-22. And that very light shade of blue right in the middle of fiscal year 23-24 and the fiscal year 25-26 bars, that was additional funding allocated to the primary care fund. As you can see, we did not receive any of that additional funding for the current grant cycle that we're in. And unfortunately, I do not foresee us receiving additional funding for the 26-27 grant cycle either. Medicaid providers will continue to receive state funds in addition to the federal match. And as I showed you in that previous slide, the tobacco tax revenue does continue to decrease. So therefore, the funding for fiscal year 26-27 decreased as well. This is just the estimated amount that has been appropriated up until this date. Of course, that is dependent on the approval of the long bill. So we will not know for certain until the approval of the long bill. But right now, that is what has been appropriated to us. We will continue to pay 90% of the appropriated amounts in quarters 1 through 3, and then we will true up in the fourth quarter to the actual revenue received. So no changes there. We make every effort to issue those quarterly payments on time. However, they may be delayed if quarterly revenue collections are insufficient. And quarter 4 is almost always delayed because we're waiting on that final tobacco tax calculations to come in so that we can reconcile the end of the year. We do have a few updates. As most of you know, effective July 1st, 2025, the following changes were made to the primary care fund rules and regulations. Colorado Indigent Care Program, or CICP, was repealed, so all references and language to CICP were removed from rule. The definition of medically indigent patient was updated to low-income uninsured patient, so we no longer refer to them as medically indigent. They are simply low-income uninsured, or as I mentioned earlier in the Step 5 count, eligible patients. And clinics could begin including patients at 200% of the federal poverty level. The fiscal year 26-27 application, which is covering calendar year 2025, will include mixed federal poverty level thresholds depending on the service dates. So from January 1st to June 30th, 2025, it was business as usual. You were counting patients that fell below 200% of the FPL, so those that were 0 to 199% of the FPL. But after July 1st, you could begin counting patients whose federal poverty levels were exactly at 200%. And of course, reach out if you have any questions regarding this change, because I do know that it can get a little bit confusing. Okay, we're moving over to the Provider Stabilization Fund, which I know most of you are familiar with by now. This was established by Senate Bill 25-290 to support safety net providers. I'm happy to report that all 33 of the current primary care fund grant recipients are receiving funding from the Provider Stabilization. Primary care fund grant recipients may submit an attestation form to confirm that they would like to use their primary care fund application for the Provider Stabilization. The primary care fund patient count includes patients up to 199 of the federal poverty level through June 30th, 2025. So any providers wishing to include patients between 199 and 200% of the federal poverty level, so that 1%, must apply through the standard application process. So that would include filling out the provider stabilization application, as well as securing an outside entity to certify your numbers again. You can contact Mindy Lee for any questions related to the Provider Stabilization Fund at the Provider Stabilization Fund inbox, and here is that information. I have a few reminder dates. The intent to apply is due April 10th. The application is due by 5 p.m. on May 22nd, and tentative award notifications will go out on July 6th. We've included a resource slide that includes a link to the Primary Care Fund website, where you can also find links to the frequently asked questions and fact page. There's a link to the Provider Stabilization website and a link to the Code of Colorado Rules and Regulations. And lastly, here's my contact information. Please feel free to reach out via the Primary Care Fund email address or my office phone if I can be of any assistance. Thank you for attending, and I look forward to another successful year working alongside you.